Hi everyone, welcome to Ask Your Doctors. I am Dr. K. Welcome, welcome. We haven't spoken in a while. We took an onset break and now we are back with a bang. And today we are fortunate to have in our midst a clinical dietitian, Ms. Palesa Maleka. Welcome, ma'am.
Thank you for having me. It's such a pleasure being here.
Thank you for making the time. Thank you. And I have a personal story, by the way, that I've been asked to relate. It's got to do with how my diet enabled me to live better and suddenly feel better, and it suddenly got rid of half of my ailments. Some of them are still there because they are chronic in any case. But let me relate the story to you. The year was 2015, and I had a small lump that I suspected needed to be examined. And I went to hospital with Dr. Minga's assistance. He referred me to a surgeon. The lump was removed, and we did all the formal medical surgical stuff, and it was identified as a very long name, myxofibrosarcoma, so you don't want to say that name again. And incidentally, what helped me, ma'am, is my family said, I was told that the lump had about a few millimeters.
Where was it?
It was in my chest.
Oh, okay.
More like male breast tumor or whatever.
Okay.
Yeah.
Okay.
And someone said it like that, although it was unofficial. So I was told by the surgeon that I need to come back and remove the rest of the tissue that was surrounding, because if you have tissue, if you have tumor cells around the tissue that was removed, then what happens is you have to come back, they remove a wider resection, they call it. They do a wider resection, and they remove more tissue around the tumor so that they make sure that they clean up the area.
Yeah.
My mother nursed, incidentally, 4 of her siblings that had cancer. So she said to me, listen, I have nursed my siblings that have cancer. I don't want to do the same with you at such a young age, at least. And she said, do not do that resection. And I said, but the doctor's here. She said, come home. She took me to, the medical people call them mambo jumbo, but she's a diagnostic reflexologist.
Okay.
And this lady did a few things, lymph drainage, this and that, and changed my diet. Most importantly, changed my diet. Now there's a picture that you may see on the screen that depicts me in 2015 on the day I was removing the tumor, and it depicts me in 2016, 1 year later. So I had to quit 5 things for me to look like that.
Okay.
Okay, it was 1, red meat. I stopped eating red meat. 2, it was wheat.
Okay.
Wheat products, pasta, pizza, bread.
Yes.
And 3, it was alcohol. And 4 was sugar.
Okay.
I consider these main because the difference I feel when I take any one of them is very big. And then the 5th one was most dairy products, but I don't consider this significant because it was alleged that I was lactose intolerant. Now, the whole thing was done with a few medical tests done and a lot of anecdotal stuff that I found out myself. But if a picture tells 1,000 words, then I'm glad that the difference was noticeable. And I can tell you now, every time I gravitate back to eating the wrong stuff, I feel it.
Yeah.
I have asthma, I used to have piles, I used to have bad sinus, meaning which is seasonal allergies. And now, when I gravitate back to the wrong food, I actually get those symptoms back.
Yeah.
And when I stopped eating that, then my health improved.
Did you stop forever, or was it like a one-time thing? Can you be able to visit the food once in a while in a certain amount? Because I've got a story of my own to tell as well when it comes to that. One of the reasons why I'm a dietitian today was a very personal decision that I needed to take.
Okay, let me answer you before you tell us your story, because it's important.
Yeah.
People out there, we need to inspire people so that they can aspire to what you are.
Yeah.
Thank you. So if I gravitate back to them, I get sick.
Okay, so I just want to know, because with my experience with food and stuff, I've noticed that there's people that are not actually lactose intolerant, but they are intolerant to the amount. What do I mean by that? So let's say if you drink milk. So if you happen to drink 250 mils of milk, that is a little bit too much for you. But if you drink 100 mils, your body can tolerate that. So with you, is it just the meat itself, Or have you noticed whether it could be the amount, or if you mix the meat with something else, you're fine? Or did you specifically talking about a certain food group?
If I eat red meat, for instance,
Yeah.
I will feel bloated within a few
No
hours.
matter the amount, no matter if it's mixed with anything else.
No, but I agree if you're at the braai, you don't want to take a small piece.
That's the problem. That's the problem. We want to indulge.
I don't want to nibble on a piece of braai meat.
Yeah.
You eat braai meat, you know?
Yes.
Yeah.
Yes.
So in any case, welcome. Please do tell us about your own background as a clinical dietitian, and yeah, tell us your story.
So with me, I've got a little bit of a story similar to yours. I come back from a family where we're a very big family. And when I say big, I mean I'm an African, first of all, right? And all my family, big thighs, big boobs, big bum bums, everything is big. And growing up, that was very difficult for me. You know, being in grade 1 and you're like the only giant kids and everybody there is just like skinny and all of that. And you're just like, why do I look different from everybody else? As I got older and older and older and older, that has always been my life. And I realized that I was somebody that was very interested in food in general. What I noticed as well when I was a child is that I would eat, if I were to eat beetroot, and then go to the toilet and I'll go to the bathroom, it comes out exactly as it is. So if I eat pumpkin.
But isn't that for all of us?
I mean,
Beetroot?
no. I mean, no, it's not supposed to be like that, right? Arkhani, number 2, maybe utla bale khalanyana.
Oh, okay.
But mine comes out as it is, right? But then
I see what you mean.
But then with other foods as well, I would eat now and then I'll go to the bathroom immediately, which is like a second later. And I would always be like, but that doesn't happen to anybody else. Why do I just eat now and then they call it a fast metabolism. But for me, that was like, because now that means I have to eat a lot and then now I'm so big and that is a problem. When I was in varsity, I actually went to UP. I was doing medical sciences the first year. I met a lady who was a dietitian because I got sick when I was on campus, and then they sent me, because I always had stomach problems. It's either my tummy would be so bloated after eating or I'll have a runny tummy. If I don't have a runny tummy, I've got constipation. There was never in between. But that time I got very sick. And then they sent me to the dietitian who was working in the department, because they've got like different departments. They're like, okay, please just go maybe see the dietitian, because I went to the clinic on campus. Then when I got there, she told me that I've got IBS, and she told me a whole lot of stuff. Yes.
Which is?
Irritable bowel syndrome.
Thank you.
Right? And at that point, they also thought that I have AGE, which is the acute gastroenteritis.
Okay.
Right? And they did a lot of tests, and they sent me again to a gastroenterologist. And
it's a long word. I have a problem with this.
And with me going through all of those things, they're doing tests and they couldn't find what was wrong with me. Then I saw that when I started eating different type of foods, my body would change. I would feel a different way. So what changed my life was starting to exercise and eating well. Now, the pains from my tummy, there was no pains at all anymore. And I asked the lady, I was like, so what are you again? Because to me, like being a dietitian was like, what is that? But she was white as well. And then I saw that in this, there are no black dietitians as well, because all of them, when I was at UP, they were white. So I thought, oh, okay, maybe it's because of this university. I started doing my own research, because now I was more interested in what I'm eating. And when I started, exercising, I saw that my IBS was now a little bit better than how it used to be. And I didn't have to take medication for remember I said it's either I was constipated or I had a runny tummy. So now I have to take pills, because now you can't be having diarrhea 24/7. So you have to stop. When you stop it, then now I saw that there's something wrong with what I was eating. Then eventually, when I left UP, then that's when I went to SMU, and that's when I chose the career that I chose, but mainly because of my own personal healing journey.
I need to say, I was inspired to start looking at health in alternative ways. And start being vocal about health through my experience with health. I became a dentist through my experience with teeth.
Yes.
And so that's why I believe you can be the best you by you through someone else and through information.
Yeah.
I always say this. And irritable bowel syndrome, is it basically you said runny tummy? It is summarized as that.
Yes.
You can have a combination of constipation or runny tummy or bloatedness or what's the other one?
So you also get pain as well.
Yes.
You get bloated.
Yeah.
And your gas also is another thing.
Gassy as well,
Yeah, and it's not a very nice
What's the
smell.
word for gassy again?
Flatulence.
Flatulence. Ah, I like the word. Yes, yes. Okay, in case you are wondering why we started with number 2, it's because today we are talking gut health.
Yes.
That we didn't tell people.
Yeah.
And we are talking about how diet can influence positive gut health, and diet can help us live better, and how we can incorporate gut health into a healthy lifestyle.
Yeah.
Thank you. Quite a comprehensive introduction. And I like the human story in it because it is the best you by you.
Yeah.
And
I think the best teacher also in life is experience. I think for me to do what I do best is because I've went through a lot of things that a lot of my clients would go through. I still suffer with my body even today. So for me, I'm able to tell you, other than just me reading from a book, I know what I had to go through all those years. I know what I'm still going through even today. So for me, it just makes it a little bit easier when I know personally as a person, nobody could help me, but I'm able to help myself.
Awesome.
Yeah.
Now we have exciting news for you.
Yes.
In case you are a brand out there that would like to advertise on our page, we have seen tremendous growth, tremendous following, and there are brands that may want to align with us. Please go to our website, askyourdoctors.co.za, or you can send us a DM on one of our social media platforms, Instagram or Facebook, or you can also use the email that you see on the screen right there. Okay, so you've inspired people to become dietitians now. And do you have to be inclined towards science subjects to become a dietitian?
Yes. You actually need like a level 4, but like level 5 in life sciences and physics and mathematics.
What's level now?
I don't know. Lenaba Tobaileng School got 1980 something.
Don't go there, you know.
So it means you get like 50% upwards
Okay.
in matric, 60 in life sciences. So we need 60s, life sciences, physics, and mathematics.
Okay.
But that's what you actually need. And obviously, just like the health subjects that you need. That's just about that, yeah.
To you young people out there, you know maths and science are important for what we're talking about today. In any case, and we did ask our audience to give us questions. So some of the questions may be spot on, some of the questions we need to redirect a little bit.
Yes.
There's one about gastritis, which I felt, not to be unfair to the audience person that sent the question, is a little bit more medical, and we would like to stick to diet today. But thank you for sending the question regardless, and please do not stop because we didn't use the question today.
I think for me, what I can just say is that I would love to actually help the person that sent that question, because gastritis is more gut related and also diet related as well.
Go ahead.
Yeah, so if they had, they've been diagnosed by a doctor, so they obviously have more information regarding that. So you can just DM me, Dietitian_Palesa on IG, and then I'll just have to love to give you a consultation so that I can be able to assist you further.
Let me tell you what I spent my time doing in the time when I had my lump. I would say I would read up and find that I have bad lymph drainage.
Oh, yes.
Okay, so my reflexologist used to do lymph massage on me. But in the meantime, I would read on the internet food that helps with lymph management. And I would also be told that my yeast levels are a bit high. And then I would say to the internet, food that helps manage the yeast. So food that bring it up, food that bring it down.
Yeah.
And they say you must, that's the reason why I start with food that does this, is because that's something that you are able to do every day.
Yes.
So if you can clean up your fridge and only leave the good food, then you are on your way there.
I like what you're saying. A lot of people, actually young people recently, when I see a lot of clients have seen that we actually suffer from diabetes, right?
Yes.
And we always thought, but that is such a different story right now.
No, you inherit it. That's what we tell ourselves.
Yes. So I like what you're saying with when you're saying like food that actually takes it up or down. Diabetes as well, when I explain it, I always tell people that there's 2 different types of foods. The one that take your blood glucose high and the one that takes it down. So it's always just easier to explain it that way.
And those that keep it level.
Those that keep it level.
They say you must use food as medicine now. I'm sure you've heard this before.
Yes.
To avoid using medicine as food in the future.
In the future, yeah.
And diabetes, incidentally, I've come to say, the reason why I speak a lot, guys, is because this is personal. So I'm just using you as a conduit to make sure I'm not straying too far. So diabetes is like being born in a squatter camp. You do not say, I inherited the life of a squatter camp person. Being born in a village, like I was born in a village.
Same.
I inherited being in a village, but it's not something I carry with me right through.
Everywhere you go, yeah.
So you work very hard to get yourself out of the village, out of the squatter camp, out of the socio-economic situation you were born in. So diabetes is something that you work very hard not to take with you because you inherited it. So genes are one, but there's a lot more lifestyle-related issues that lead us to live with diabetes in the future than just genes. So
hence
lifestyle is a big
lifestyle health issues.
Thank you very much.
Yeah.
And tell me, someone says here, how can I lose weight without any sort of medical intervention?
Okay, so I would have to, first of all, what medical interventions, because there's a lot, right? Will that be
Let's say surgical.
taking, yes, you know, liposuctions and all of that, and, you know, there's a lot of other things. People take pills and all of that.
Let's start
it's
with
very
what
simple.
you do.
So it's very simple, right? It's not complicated. So if you change the type of food that you eat, you work on an elimination process, and then you also drink enough water. Those who follow me, they know I talk about water a lot. It has changed my life. It has changed my skin. It has healed my IBS in one way or the other. So if you drink enough water a day, and then now with weight loss, you just work on avoiding more than anything. So if you know the food that you need to avoid, then you'll know what type of food that you need to eat. Right? So that is that. So you focus on healthy food. So obviously we're talking about more fruits and more veggies, right? And avoiding fried foods. I'm a big advocate for air fryer. So if you like your fried foods, please use an air fryer instead of just deep frying your foods and all that, because that's an unhealthy way of eating. So that is one. And also exercising is very important. That you cannot run away from that. Exercising is very important, and I know there's people that are physically challenged that are not able to do that, but there's always a form of exercise that people can do, right? Even if you can just move around in the house and go, that is if you have any sort of disability. But if you're like a normal person, you want to lose weight, running, if you don't have access to facilities or anything like that, just run in the streets, but exercising and healthy eating and drinking enough water, those are just only the three things. There is no magic to weight loss. And people here, I give out diets, yes, but I'm not really pro saying that's why it can never be you taking a diet from everywhere and be like, okay, I'm going to eat carrot today it's cucumber. No, you can keep it clean and keep it natural and keep it normal and still lose your. And another thing is, the longer it takes you to lose the weight, the longer you actually keep the weight off. That's what people don't understand. So you can't just lose 10 kgs in 3 weeks and expect that weight to still be gone. It is still there, because that's where you're going to be, you're going to actually gain it all back quickly.
Speaking of fruit and vegetables,
Yes.
Palesa,
Yes.
is it true that you need to have a little bit more vegetable than fruit, because fruit might spike your blood sugar levels?
So I would say that it differs, right?
Okay.
There's people that have got insulin resistance, and there are those who don't. So
Okay.
with the spiking of the glucose levels, it's mainly for people with insulin resistance. But if you just normal glucose levels, it really doesn't matter. But I always say that at least take fruits that have high sugar with fruits that don't. What do I mean by that? So your mangoes and your bananas and your grapes have got high sugar. But when you look at your berries as well,
Yes.
they don't have as much sugar. So if you're going to have 3 fruits a day, maybe have your banana, right? Maybe in the morning, and then mangoes, and then in the evening, opt for fruits that have got less sugar, which will be your berries. So definitely, yes, have more veggies than fruits, especially the green ones.
Yes.
Yeah.
While we are there, what's GI?
Glucose, the glycemic
Glycemic
index. Yes. So the glycemic index is just what I spoke about earlier.
Yes.
In a lighter note,
Yes.
to tell people, right? There's high GI foods and there's low GI foods.
We want to know what the difference is.
Yes. So the difference is, if I were to explain it for normal people to understand, the high GI foods are the ones the fruits that take your glucose levels high. The low is the one that takes, the low GI foods are the one that just keep your glucose levels low. So for instance, if we look at white bread and brown bread, So white bread is a high GI food and the brown bread is a low GI food. Now why? Because of the fiber content in them.
Okay.
Right? What does fiber do? Fiber helps to control the blood glucose levels in your body. So the white bread doesn't have as much fiber, right? So it takes your glucose levels up. So it doesn't really help to control it. But when you've got the fiber, what does it do? It helps to control the glucose levels. That's just one example.
So what's wrong with glucose levels that go up?
So
what do
that's
they do?
It with they cause diabetes.
How does that happen?
Okay, so if we're going to go into medical,
A little bit.
just a little bit,
Diabetes is
right?
a big thing.
Okay, so diabetes mellitus, that's what it's called. There's two types of them. There's type 1 and there's type 2. So with the type 1, that's when you're actually born with it, right? Now we've got what is called insulin, which is a hormone, which comes from what is called the pancreas. Right? The insulin controls the glucose levels. So if your body does not secrete enough insulin to control the glucose levels, what happens? The glucose levels are not controlled. So it's either they go high or they go down. So that's what is called hyperglycemia and hypoglycemia.
Hyper and hypo. Okay.
Yes. No, there's two. So hypo means it's too low, and then hyper means it's too high. The most common one, we just call it the diabetes. Right? Tsukir, one as well. So it is caused by insulin. Whether your body secretes enough insulin or it doesn't, coming from a lot of reasons. It's either because your pancreas is infected, or you got a car accident, or anything of the nature. But it comes from that. But when it comes to the food part of it, food can also cause insulin resistance, right? Especially the fat. So if your BMI is over 30, so what happens, your pancreas secretes insulin. So if there's too much fat around it, what does it mean? If your pancreas releases 5 units of insulin, for instance, or 10, that's what you need to control your glucose. But now it cannot secrete as much because of the fat around it. Nah? So if it's supposed to secrete 10, now it secretes 5. What happens to your glucose levels? Because of the fat around it.
They keep up there.
They keep up there because they're not controlled with the insulin. Now this is where it comes with us giving you what? Injection.
Insulin.
Or we give you the pills to do what? To support the insulin. This is where the diet comes in terms of preventing diabetes. Why? Because of the amount of fat that is surrounding your pancreas, in simple terms.
Okay. Now, high blood sugar.
Yes.
I want us to go to the part where high blood sugar means you have to take the sugar somewhere and you store it as fat.
Yes.
That's what I wanted us to say.
So what happens is that when you've got too much, hyperglycemia means that you've got too much glucose in your blood.
Okay.
Right? And then what happens to that too much glucose? It causes a whole lot of other factors. Now this is where again it comes from, where you're talking about the fat storage. Right? And then this is where it also causes what? Obesity and all those kind of, because of the insulin resistance. Because in most cases, people can, that's why I said, when you've got insulin resistance, it's either you've got hyperglycemia or you've got hypo. So with people with hypo, that they lose a lot of weight. I could give examples of well-known people that we know that have suffered from diabetes. A lot of them will lose a lot of weight, and people will be like, no, but wait, this person has got diabetes, but why have they lost so much weight, right? Because the side effects are different. It's either you can be very big or you can be very small. Why? Because there's a lot of things that are not working properly in your body.
I'm so happy that we handled diabetes. It's it's probably the only chronic condition that we'll have time for.
Yeah.
So that means you'll have to come back.
Definitely.
We're not done yet.
This is my home.
I know. We won't dwell too much into it, although I'm excited and I wanted to ask more. But sugar is stored as fat.
Yes.
So the more sugar you eat, the more weight you will gain.
Yes.
And not the muscular kind of weight, but the fat kind of weight.
The danger of that is that the most fat that we don't want, it is the one that is surrounding your vital organs, which is your heart, your pancreas, your other vital organs. And this is why I am against central obesity. Look, you can have fat everywhere else. Central obesity is having a lot of fat around your tummy.
What are you saying to all of us?
I mean, that is the fat that we don't want. Why? Because it is surrounded around your vital organs. This is the most important part of your body. Your arms, your legs, you can walk cute, right? But the health is here. Everywhere here. This is where your heart is and everything else is. So we want that tummy to go down, not because we want you to look good, but because we want you to be healthy. Well, that is a plus. That is a
And the
plus.
older we get. Okay, let's go back to our social media questions.
Yeah.
Flat tummy tea, is there anything you can say about it?
Oh, so I did I will just go to my 21-day challenge thing
Yes,
that I
ma'am.
did.
Right away.
Right. Listen, in the lives that we live in, I actually want to go into aesthetics and medical weight loss and all of that to give more insight, but we'll talk about that one day. Now, with the flat tummy tea, I've noticed that people will use anything to make themselves lose the weight. Either it is unhealthy or it's not, right? So when it comes to the flat tummy teas, there is, can I just say this, and if there is anybody who wants to kill me, they can. There is no such a thing that is called a flat tummy tea. It's just a normal tea that they just put in and they said it's a flat tummy. Now, what did they add to that flat tummy tea? It's just that they add senna, which is one thing that keeps, that takes you to the toilet more, especially for those that suffer from your constipation and all of that. And also there's certain herbs that also help with decreasing the appetite. So that's what helps with that's just the two. It's either you're going to, take out the food more or it's going to decrease your appetite. But most of them, all these teas are all the same. That's green tea. They put a little bit of some other leaves in there to help either with appetite or takes you to the toilet a lot. Is it healthy? Absolutely not.
Okay, that puts an end to that, because the next question was going to ask, how often should I drink it? So I suppose
no. So what I would say, I'm somebody that I told you that I suffered a lot from constipation.
Yes.
So what helped me a lot was the green tea, just normal green tea that you buy, right? And either drinking hot water with lemon in the morning. Even if I take hot water in the morning without eating anything, it helps me naturally to go to the toilet, right? Now, that is one. And also with the green tea as well, it also helps. So now with this, it's just when you take it on an empty stomach, it is bound to assist you with the two, right? But there is other flat tummy teas that are added more senna, which is the one that makes your tummy run even more, which in the long term can be very unhealthy. So people need to be very careful with that, because it can mess up your whole gut.
Now, does cutting out food like carbs help with either gut health or weight loss?
So one of the biggest myths that is out there is that one, that, or if you want to lose weight, just cut carbs, don't eat. We need to go back to start by saying, now why do we need to eat carbohydrates? That's number one, right? And there's different type of carbohydrates. Nah?
Okay.
I would say there's good carbs and there's bad carbs. But what makes it good carbs and what makes it bad carbs?
Cake.
Definitely, right? So we've got food groups, 3 of them, right? Fat, the macro ones, protein, and carbohydrates. Okay. They're all important. If you've got a plate, make sure that your plate has got the 3. Right?
Okay.
That is what is called a balanced meal, and that was what is called healthy eating. So now, I would say, do not cut your carbs completely.
Okay.
Reduce them. That's number 1. Focus on the healthy carbs. What are the healthy carbs? The brown ones that have what? Fiber. Okay. That's number 1. Fiber is your best friend for weight loss. Right?
Okay.
That is number 1. Also, very important for tummy reduction.
Okay.
Nah? So fiber is very important. Why? Because fiber also keeps you fuller for longer. So if you were to eat 1 cup of white rice and 1 cup of brown rice, nah? So you'll be fuller with the 1 cup than how you'll be with the white rice. So chances are you're going to have 2 cups of the white rice. Why? Because you wouldn't be as full if you ate the other one. And you've got the better benefits from the brown. So don't cut carbs altogether. That is not advised. That is not good. But rather focus on the brown and the healthier carbs. And also portion size is very important.
Portion size?
Portion size is very important, yes.
Long grain rice, any significance?
As long as it's not brown, it's not high in fiber, no. Anything that is not high in fiber, when it comes to carbs, I would say it's a no.
Okay.
Yeah.
And you did say make you feel fuller.
Fuller for longer, yes.
I like that.
Yeah.
What foods naturally are good for your gut?
Definitely, like I did say, fruits and vegetables.
It's a question, but I have to ask it.
Yes. Now, I always tell people, if you're going to talk about healthy eating, your best friend is fiber. You want to have a flat stomach, right? You want to have a glowy skin. Gravitate towards your fiber. You want to have good gut health, like your good microbes and the gut micro floras that you find. You find them from fiber. So the main thing that you just need to talk about, or when you're talking about healthy eating is just fiber.
Sorghum.
Mabele as
Yes,
well.
ma'am.
Amazing. Why? Because of the fiber content in it. O kgoletse ko magaeng wena. If you look at the food that we used to eat, your beans, right? Beans are healthy because of the fiber content in it. Why? Because they're good for the gut, right? And mabele as
And
well.
the protein in the beans as
The
well.
protein in the beans as well.
Yeah.
Mabele, good. Why? Because of the fiber content in them.
I'm holding back a lot because I don't want to take your space. But
Yeah.
I've argued with people online when they said to me, you speak of rice, this and that and that. When we were comparing mabele rice and let's say wheat and maize, people say, but we eat pap and this and that, and our grannies live till 100. I make them aware that the pap that we eat doesn't have as much fiber and as much. The one that we used to grind down ourselves.
It is almost 100% natural.
Yeah.
Yeah.
And it used to have a lot more fiber and a lot
Yes.
more, like now it's more refined.
It's more, they
basically.
stripped it off of all the, and also
The
let's
good-
go back to
yeah.
the portion size as well.
Yeah.
I mean, I eat bap once in a while, but if I'm eating this much of bap, does it really make that much of a difference? Definitely not, right?
Yeah.
But if we load your plate the ale and half of your plate ke bap,
Like the
Now.
chisanyama style.
exactly.
Okay.
All right.
Everyone knows what they eat at chisanyama. We don't need to explain. Raw fermented foods.
So anything, like I mean, fermented obviously because of the gut flora that you,
Yes.
the good ones. So that because of probiotics and the prebiotics that you find in fermented foods. So they are definitely perfect. You know, they are good because of the fiber as well that you find, and also because of
Raw
the
food.
raw food. It depends what we're talking about. The only healthy raw foods that you can eat are fruits and vegetables. Nothing else.
I thought so, but I thought I would ask you. It's a fair question because now I know more.
So I don't know what do they mean by raw foods. Like
I don't know. The question says people are eating raw foods these days.
it's like raw meat.
I don't want to go there.
Yeah,
It
no.
wasn't asked.
So no. So whatever the raw foods that they mean, the only say I would say thumbs up to is eat your natural food as much as possible, which could be the fruits and the veggies. Anything raw, stay away from it.
And let's not allow things to be so raw that they are difficult to digest. And digestion starts in the mouth.
Yeah,
And if they are too difficult to chew, they might damage your teeth and they may not go down well. So let's be practical about the rawness of the food.
Yes.
You spoke about gut flora, and there's a question here that says, what are probiotics and prebiotics and what good do they do for my gut?
Okay. So
in general health anyway.
in general health anyway, yeah. So probiotics, I'm very big on this, especially for people that have got gut issues like your IBS, like me. So I take probiotics every single day. So there's, in simple terms, probiotics are more like supplements, right? You do find them in certain foods, but it's very difficult to find them. That's why I would say they're more like supplements that you
Especially with our modern diets,
take. Exactly.
where we take away.
Yeah.
So you want to supplement with a good
Yeah, so the probiotics is just a good flora that supports your intestines that you find actually in your stomach, right? So the prebiotics as well is the food that you give to the good bacteria that is in your gut, which is the
I never
what?
knew that.
Yes. So
Which
which is your veggies, your fruits, and your high fiber foods and stuff like that.
Okay.
So those are the prebiotics.
Okay.
Nah? So the probiotics is a supplement, the peel that you find.
Yeah.
Nah? Why? Because it is almost impossible to find it in food. Nah? Which is the bacteria that is needed for the gut. Prebiotics are the food, right, that you feed the good bacteria in your tummy.
Enough said.
Yeah.
Lactose intolerance, does it affect weight loss in any way? Or is it, if someone is lactose intolerant, is it more difficult for them to lose weight? It's a question on social
No,
media.
actually, it should be easier for people who's lactose intolerant to lose weight. Why would I say that?
Provided they do not stuff themselves with milk.
Exactly.
And the amounts and
Yes.
the likes.
Now, people that are lactose, if they are going to take anything dairy, if I can put it like that, but that is, you know, lactose free, it would be plant-based, which is good because it has a high fiber and it has high protein. Né?
Yes.
And then for a person that is not lactose intolerant, they will take something that has lactose, which is high in fat.
Yes.
Right? It is high in protein, but the main thing is it is high in fat. So if we were to take two people, the one who were to lose more weight would be this one.
Plus, is good with other things as well. If you take plant-based
Milk, yes, that's what I was just saying. Yeah, yeah, yeah.
like your not only
Soya, your almond.
your almonds, it's good
Yeah.
with oils that you need in your
Yes,
body.
yes,
So I take
yes.
rice milk powder and I find it's very rich. And it's good for my sleep as well. But that's a story for another day.
But because also you've got wheat, you can't take wheat.
Yeah.
So that at least you're getting some sort of healthy wheat
Yeah.
from that, which is more natural, which actually is able to supplement your. That is a good choice. Out of all the milk, you did well. That is a good choice.
Thank you very much. Thank you very much.
Yeah,
No.
yeah, yeah.
Affirmation is good for you to be invited back.
Yeah. So lactose intolerant people, it is way easier for them to lose weight because they can eat ice cream, cakes, and all of that. Like, come on. I would have the best body right now if I was lactose intolerant.
On a serious note, do you think you should come back one day we discuss IBS on its own?
Definitely. I think there is certain conditions that we can talk about. Maybe like IBS, maybe go back to diabetes as well.
On its own, yeah.
Yeah, yeah. And then let's just focus on condition-based.
Yes.
Yeah,
Now I
that
feel like
involves.
we should do justice to some of these things.
Yeah, yeah, yeah.
And
we should.
please,
We should.
let's schedule how you can come back and let's discuss this stuff.
Yeah.
Number two, not to do number two every morning. Is
Mm-hmm.
it a healthy thing to do and is it normal?
For me, I always said our bodies are different, right? Some people do number two every morning, that is okay. But there is no time frame that says people should poop every morning or people should, as long as you go to the bathroom at least once every single day, that is perfect. Whether it's in the morning or it's during the day or it's in the evening, that is perfectly fine. So you don't have to, it doesn't have to be in the morning.
Practically speaking though,
Yeah.
it's easier to do it in your own bathroom
Of course.
than at work.
Yeah.
And I take alkaline powder, and 10 minutes later, with a glass full of water, 10 minutes later, I'm sorted.
I drink warm water with lemon.
Yeah.
30 minutes later, I'm sorted. So
Okay,
it's different with different people. If I don't poop in the morning, I'm grumpy the whole day. Just in case if you see me and I'm grumpy, just know.
And what needs to be known is that your colon is designed to absorb fluids, and
Yes.
it absorbs water. So when you take water away from the poo that's in the colon,
That's when constipation happens.
that's when and then it piles up. So if you don't make efforts to poop in there every day, no matter what time of the day,
Yeah,
then you are causing constipation.
yeah.
So
And one thing I can say that if people can take away from this is just make sure you drink enough water every single day and make sure you at least drink 1 to 2 glasses of water every morning on an empty stomach, right?
Okay.
While you just spoke about how the colon absorbs the water.
Yes.
Now imagine when you're eating, especially fiber, and there is no water in your colon, what is your colon absorbing?
and you're piling up, and it's like
Exactly.
Yeah.
People, high fiber goes with high intake of water,
Yes.
right? So before you put in fiber, let's talk about cement. It's the same thing, right?
Yes.
In order for it to be cement, so you take and then
Yes.
what happens? Same thing. So think of cement as fiber and think of water as the water obviously that you need in order for smoothness.
And
to
if there's
happen.
not enough water in that cement, it hardens quickly and it
Exactly.
doesn't come out. Thank you very much.
Yeah.
Does beer cause belly fat, and how does that happen?
Everybody who knows me knows I hate alcohol. So
Hypo.
yeah, I'm
Okay.
very, but I drink champagne just in case.
Oh, okay.
Yeah, but then
Not in the script, but it's fine.
just a disclaimer, because people, you spoke about beer, so now I'm talking about different types of alcohol.
Okay.
Right, so alcohol as on its own, it's alcohol at the end of the day, but there's different type of it, right? There's champagne, there's gin, there's cognac, and there's beer, there's all of that. The question is directed to beer. Nah? The problem with people that drink beer is that they don't take one. Abantu fela dampinyana. Babatla, boma 6, boma 12.
Binge drinking.
Yes. Now that's where the problem is. I would say there's nothing wrong with beer if you were to take it in the amounts in which that you're supposed to take. Even the bottle itself is written, you know, that consumption, a lot of it is detrimental to your health. Now the problem with beer is the amount that people take,
Okay.
not the beer itself.
Are
Because
there ingredients in there?
alcohol in general is not good. There's no reason for why people drink alcohol. Let's just keep it 100, right? But if you're going to take, now remember your portion sizes. This is why a lot of our uncles are walking around with big bellies. Sorry, Malum. But yeah.
Not just our uncles, our 24-year-old brothers.
Yeah.
And sons and daughters sometimes.
And there's a thing in our community that is called a pooza phase. If alcohol was okay, why would you, why would it ban your face if alcohol was okay?
Okay. In any case, this one is addressed personally to you. Hi, Palesa. I'm 100 kg of weight. My weight is affecting my confidence and performance in bed. What advice would you have for me? I don't know if it's male or female, but I suppose it would apply either way.
Now, this is why I do consultations and face-to-face, right? There's people that are 100 kgs and then they look like me. There's somebody who's 100 kgs and they look like you, right? In terms of its muscle or its fat, or is it central obesity, or is it your legs, or is it all of that, nah? That's number one.
But this one is affecting.
It's affecting them. Nah?
Confidence, so it must
confidence.
be a bit
there is no any other thing than I always tell people that I can be so skinny or I can be a certain body and then my body affects your confidence one way or the other. The one advice I can say is that love the body that you are in right now at the end of the day, because it is carrying you, you are alive because of it, but make means in order for you to lose it until you are comfortable. What I would advise also is that find exercises or physical activities that speaks to you as a person, that you'll be happy to do, whether it's at hiking or it's walking or joining Fight Club, one of my favorite things in the world to do, or doing anything, but there's nothing else that they can do. They just need to find a way to lose the weight and get back their confidence again. But the most important thing to do right now is to still love their body while they're still transitioning to where they need to be. And should they need any more help, I'm always available. I help a lot of people. Then they can always DM me and then I can assist with that.
To love yourself is important because you avoid depression. Depression can cause you everything to spiral out of control.
Yeah.
So it should be a lifestyle and it's not a sprint. It's a long journey until you die.
It's a long journey, yeah.
I like the ones that say, hi Palesa, and I'll say it, hi Palesa, I wonder if you can help me with this one. Whenever I become stressed, I lose my appetite.
Okay, so that has something to do with, it could be also anxiety, one. I suffer from that as well. I was actually diagnosed. That's
our next question.
Yeah. We might as well just tackle the both.
Yes.
I was diagnosed with anxiety this year. One of the reasons why I took some time off work is that I had to go to therapy, and which was a lot, right, for me. So what I noticed is that stress increases my IBS from, I get a runny tummy a lot.
Next question.
All right.
Runny tummy.
That is one. So anxiety, runny tummy, the stress that also comes with that, it also definitely does reduce your appetite as well. So that they need to find a way to control stress management. That is one. So that is more psychological more than anything. There's no pills or anything that a person can do. You just need to manage your stress, right? And the anxiety that comes with the stress does definitely decrease your appetite. So you need to find a way to balance the two. And I'd advise them to go see a psychologist or somebody that I can assist them with that, because there is more mental and the stress management. And then for them to just try and eat when there's nothing else that can be done. If you don't have appetite, you don't have it. There is no pill that you can take that will give you appetite. You just need to find a way to know that food is very important, and food can actually take your stress a little bit away, which is healthy eating and exercising. So if you feel a little bit of stress, go outside, take a walk, go exercise or something, and then when you come back, maybe you'll feel a little bit of more hungry and eat. I would say eat food that you love, but if you love McDonald's, that's not healthy for you. So just focus on healthy eating. It makes you feel good about yourself. You feel like you've done something for yourself.
I feel like there's not enough time for the stuff that we want to discuss, and definitely we need to do something about this.
Yeah.
Come back again, and then now before we wrap up, we would like to go viral with Dr. Bunolo Mashishi on COVID updates.
So South Africa is definitely experiencing its fifth wave of COVID-19 infections. We've seen an increase of the number of cases across all the provinces. We've seen an increased number of hospitalizations or people seeking hospitalization due to COVID disease, and there's been increased number of deaths reported. What's been interesting is that the new wave of COVID-19 has been associated with subvariants or different lineages of Omicron. So it's still Omicron that's going around, but it has slightly mutated and changed.
As always, thank you very much, Dr. Mashishi. We are still hanging out with the lovely Ms. Palesa Maleka, clinical dietitian. Thank you very much. Before we let you go, can you just debunk one or two myths for us. Some that you know. There's one about detox.
Yes, oh gosh.
Tell me more.
Yeah, so the main things that I've seen, especially when it comes to weight loss, definitely the detox part. We spoke a little bit about the carb one, which is a big thing. People's like, oh, avoid carbs, that people don't need to do that. And also the juicing one. No?
Okay,
okay.
The second one.
That is so there's actually three. Can I just say there's three? The one that says the carb one, that is also a myth. You don't have to stop to cut carbs in order for weight loss. You don't have to do that. That is a myth, right? So, but we'll focus on the detox parts of it and the juicing. So the juicing definitely does form part of what people call the detoxing, because people will stay 5 days or 3 days without eating anything, and they'll just be drinking nothing but juices. Okay. Now that is not healthy, first of all, right? Because we need to go look at what is healthy eating and healthy living. Healthy eating means that you get to eat both your macro and your micronutrients with every meal that you're having. As food, not as drink, not as supplements, not as anything, but as food as they are. Now, when it comes to detoxing, what does the word detox even mean? It just means taking out the bad.
I've used it before, so I'm very anxious.
Yeah. So it means like taking out the bad and now putting in the good.
Yes.
I am pro detoxing, but in a different way.
Okay, cool.
I'm going to explain what does that mean for me. Now, in Jan, everybody goes, I'm detoxing. What does it mean? You are taking out the bad and putting in the good. For other people, it would be like, I'm going to stop drinking alcohol. I'm not going to drink fizzy drinks and all of that. I'm only just probably going to drink your green tea and your healthy juices and water.
Yeah.
That is good. So when you detox, think of removing the bad and introducing the good. So what does that mean? You remove maybe your takeaways, you remove your fast foods, you remove, and then now, but you focus on healthy eating, which is food. Not that you're going to remove everything and then now you drink juices. That is not correct. That is not right, and that is not, because why? It's not sustainable. It is also harming your body. Okay. So we don't want to do that.
We'll have an episode on detox one of these days.
Yes, we need to. We need to.
And the myth about juicing?
So juicing, in most places, use it as detox. When somebody says, oh, I'm detoxing, or I'm using the word I'm dieting, that's only drinking juices, but they're not eating anything else. That is also not right. It is very unhealthy, especially for the gut and the flora that we were talking about earlier. So long term, it can cause a lot of issues. It can cause IBS, can cause ulcers, it can cause your metabolism to be dysfunctional. It's either you're going to not be able to go to the bathroom. It can also cause constipation as well. So it is very unhealthy, and it's not good for your kidneys as well. So that is a no.
As a takeaway, guys, just eat a little bit of everything good.
Yes.
And eliminate.
Portion size.
Yeah, portion size is
very important. Yeah.
Eliminate the bad stuff. Eliminate too much sugar and all the other stuff.
Yeah.
Okay.
And alcohol, please. I just had to say that.
Manage alcohol.
And manage alcohol. That's why I said, like, there's nothing wrong with drinking your ciders, but there's everything wrong with drinking 12 at a go.
Okay, I'll stay out of that. And guys, you can go to our website, go to the part where you look at the menu and you say, you're looking for find your doctors. And then it leads you to all the specialists, guests, and even non-doctors that have been here. We've had fitness gurus, we've had people that you may want to show a lot of interest in. And you can go there, find their addresses, find their website, find their online contacts, and please do get in touch there and book your appointments. The same you can do for Ms. Palesa Maleka, clinical dietitian, and you are more than welcome to also consider advertising your brand on our page, on our YouTube page, and on all our online stuff. Until then, I need to ask you, where do they find you?
Yes, I also wanted to give a little bit of a takeaway for especially the weight loss. I think we all focus on either weight loss, weight gain. There's a lot of stuff, but for today we're going to focus on weight loss. I want to say for everybody who's at home right now, and it's winter right now, right? And I'm sure a lot of people are like, oh, when summer comes, summer bodies are truly made in winter, which is because it's easier, because don't go out like that. So I'm going to give you a few advices or factors that you can use right now. Do this for 2-3 months straight and see. Now, focus on 3 things. Make sure that every day you exercise. Now, you can focus on cardio. That is number 1. And also make sure that every day when you wake up in the morning, it's either you drink hot water, either with lemon or just hot water on its own, before you eat anything, before breakfast, and follow that up with the high fiber breakfast. That could be your wheat bix, your oats, your oat bran, and do that consistently for at least a month at most, and to come back to me. You'll find me at Dietitian Palesa, Dietitian_Palesa on Instagram, or Dietitian Palesa on Twitter, and let me know what changes that has made, especially around your stomach. Just do that for a good month and just let me know. That's where you can find me. I'm on Twitter and Instagram, Dietitian Palesa.
Thank you, ma'am.
Thank you.
Thank you for making the time. And do watch this again, because you will find her here. Until then, keep asking your doctors. Thank you for watching.